Hello, my name is Esmeralda Mendoza, and for 2 years I work in a parvo treatment center where I witnessed firsthand the difficulties that dogs face when being ill with parvo. Just imagine bringing home a healthy, playful puppy, and then all of a sudden it stops playing, eating, drinking, it becomes lethargic, and starts throwing up and having bloody diarrhea. A very horrible situation for everyone. Well, that is the reality of parvovirus, which is a very contagious disease and can be deadly in some cases. For example, a dog that is constantly vomiting and with diarrhea can die within 48 hours if not treated. And until recently, the only option for treatment was supportive care through IV fluids, anti-nausea drugs, antibiotics for any secondary infections. But now, Elanco has developed the first canine parvovirus monoclonal antibody treatment, aka CPMA, which attacks the virus itself and has changed veterinary medicine. But first, let's understand what parvo is. Parvo is a virus that primarily targets puppies and unvaccinated dogs. It attacks the lining of the intestines and their immune system, which then leads to severe vomiting, bloody diarrhea, and suppression of their immune system. The virus spreads very easily through contaminated feces, soil, and any other contaminated surface. But the worst part is that it can survive in the environment for months, which is why it's very important to disinfect every area that a parvo positive dog has walked through. And once symptoms start, it is very important to initiate the treatment. Like I said, the usual and only treatment before was through supportive care, but now with the monoclonal vaccine, the way parvo is treated has changed. So, how does the CPMA work? Well, it is a lab manufactured protein that is designed to mimic the body's natural antibodies, which then specifically binds to the parvovirus and neutralizes its ability to infect the intestinal cells. So the earlier it is administered, the better, so it prevents it from further damaging the intestine. The vaccine is administered intravenously, and the dosage is 0.2 ml per kilogram, and one vial contains 2 ml. So the main benefit of using the monoclonal is that the survival rate is much higher than without it. Elanco studies while testing showed 100% survival rate when administered, of course, early in the parvo stages. Another benefit is shorter hospital stays because the dog doesn't get as sick, so it doesn't have to stay for too long. And it also reduces the burden that becomes with intensive hospital monitoring. Additionally, it also reduces the emotional stress that both the veterinarians and the owner has to go through because they now have more options. Parvo can be a very devastating disease to treat, but now with a monoclonal antibody that works by directly neutralizing the virus, it has brought many benefits, mainly by increasing the survival rates and reducing the hospital stays. As someone who has been working with parvo cases up close, the CPMA is a very nice option to have at veterinary practices and also for the owners to have that another option. Thank you for your time.